So why does the lower back get tight? So I'll tell you the most common reason that the lower back gets tight, and this is a precipitating factor before somebody goes like this, grabs a piece of paper, and they're down and out for the next week, 2 weeks. We've had people that have had those episodes, and if you've ever had chronic lower back issues, you know what I'm talking about, because it literally puts you down for a couple weeks, okay? Precipitating that, though, before that happens, usually when somebody comes in, they'll notice that my low back was tight 2, 3, 4 weeks, possibly even a couple years. Like, I've always had my lower back tight in their case history. Now, why that is, this is a functional spinal unit. So you got the vertebrae, you got the disc, you got the vertebrae, spinal cord, and then you have the spinal nerves. Now, the anatomy of the disc, and this is what happens, if we're looking at the top down at the disc, you have here, it's called the nucleus pulposus. Okay, that is the disc material. So it's like a jelly-like material. So if we imagine this all floating in there, okay, and then if this green outer ring, it represents very, very tough fibers that hold this disc together and also hold the two vertebrae together. Now, these fibers are oriented in this kind of crisscross shape like this. So if you've ever stuck your fingers in a Chinese finger lock, if you go like this, your fingers can't get out. But if you go like this and twist, what happens is your fingers can escape. Okay, it's fun to show your kids. Now, when those fibers are taut, that is a strong disc. But because of loading and rotation, what happens is these fibers can become torn. Okay, and when they tear, what happens is that jelly-like stuff slips out. Okay, now back here we have the spinal nerves and the spinal cord that run back there. So when that material goes out there, it creates an inflammatory response, and what happens is the muscles around the low back tighten down, they lock up, so that way you don't move in a way that is going to throw your low back out and throw you into like a sciatic-like type symptom. So precipitating factors, tight low back. The reason the low back gets tight is these inflammatory mediators tells the central nervous system to lock stuff down, so that way we don't move in a direction that's going to cause us to go like that. That's why oftentimes you'll see or hear people say, oh, I went down and picked up a piece of paper and my low back went out. Reality is that the low back was going out long before that. So if you have that tightness, you probably have some type of inflammation going on in the lower back. So how we get rid of this is we decompress. There's a number of therapies, adjustments that you can do as far as reducing inflammation in the lower back. Thanks.